Hello, everybody. I'm Dr. Malcolm Butler. I'm a family physician at Columbia Valley Community Health. I'm also the health officer for Chelan and Douglas counties, and I appreciate you taking some time together with me today. The first thing I want to tell you about is a new app which is available on our smartphones. It comes preloaded on iPhones, and it's also available for Android devices. It's called Notify Washington in this state. And I believe it was developed by Google and Apple together, which is why it comes preloaded on Apple devices. And literally all you have to do to get it, I happen to have an iPhone, and if you go into settings, you probably cannot see that, but you just scroll down and there's something that says exposure notifications. And you can look there and it tells you what it's all about. You can turn it on, boom, you're done. So how this thing works is pretty cool. It uses the sort of low energy Bluetooth that can connect phones together. And you turn it on. And then if in the future you should test positive for COVID, you would call and you would get a PIN number. And then you would enter that PIN number into the app. And then what would happen is a signal will go out to every other iPhone that you had been within about 10 feet of for more than 15 minutes in the last 2 weeks. So these phones are basically communicating with each other. And if you're close to a particular iPhone for more than 15 minutes, it records sort of some identifier. And then if you test positive, it'll shoot something out to the app on that phone. Of course, the app on that phone needs to be turned on too. And the owner of that iPhone will receive a message: you may have been exposed. Please, get tested. Does not tell them what your name is, does not tell them when they might have been exposed. It just alerts them that they may have been exposed. The same thing works the other way around too. So if you have it turned on and one morning you get an alert that you may have been exposed, that means that the telephone identified that you were within about 10 feet of another person who has recently tested positive, and you were within 10 feet for more than 15 minutes. So pretty slick, pretty cool, easy. You just, in an iPhone, you just have to scroll, go into your settings and then scroll down and find exposure notification. And then on Android devices, I understand that you can download that from the App Store. And again, it is called Washington Notify. It's sort of WA Notify. So check it out. I think it's going to be super helpful. I've downloaded it. All my family has downloaded it, or at least we turned it on. And hopefully it's going to be effective for us. All right. I have some questions now, and we appreciate you guys sending these in. It's pretty fun. So the first question reads, if I have tested positive for COVID-19 in the past, do I need to get a vaccine? And the answer is yes, I would recommend that you get a vaccine. The reason for that is, when somebody is infected with any kind of a virus, we develop immunity to that. And that's considered, we call that natural immunity. The problem with COVID-19 is it's so new that we don't know how good that immunity will be. What we are aware of is that some people who were infected, back early, April, May, are now getting second infections. So for sure that native or natural immunity is not super strong in some cases. My understanding is if you had a very severe case of COVID-19, if you were really knocked down pretty hard, it's likely that you'll have pretty good immunity to that. But if you had no symptoms at all, it is likely you will not have very good immunity. But regardless, because we cannot tell you if the natural immunity is going to be very good, we are recommending that everybody get immunized. And as far as we can tell, being immunized after you have had COVID is not any kind of a problem at all. It's a little bit like wearing two jackets, right? Maybe you'll have your native immunity and you'll have the vaccine caused immunity. So yes, go ahead and get vaccinated. Second question reads, I keep hearing rumors about big events that people are holding this month. What is the health district's role in these events, and can you shut them down? Yeah, so just so that you're aware, we have heard a lot about these events, and we really appreciate it when people are sending us updates on things like this that they find on social media. And I just cannot express my disappointment in our neighbors who are electing to have events like this in a time when we are just being decimated by COVID. It is just so disrespectful to the healthcare providers and the first responders in our community who are risking their health and risking their family's health every single day when they drive in to keep people alive who are suffering from COVID. And then to, organize an event with a large crowd getting together, even over the holidays, it is just irresponsible and it is disrespectful. So, the frustrating thing also is we will care. We will care for you if you choose to go to this event and get sick. We cannot say no. And so for the people who go to these events and who thumb their nose at the healthcare system and subsequently get sick or make somebody else sick and then come in for help in the emergency room, we will still take care of them. And that's a little frustrating. So, third question. My father will celebrate his 88th birthday this spring. He wants a typical family Christmas. My sister says not this year, and I want to know what to do. What would you do? And I would say, we're hearing this actually a fair bit. Somebody's 88 years old, they may not have a lot more Christmases. And we've heard plenty of folks, probably half the folks in that age group, who say, I don't care about COVID. I want to see my family. So I get it. It's a really tough decision. What I would say is if everybody who's going to be involved starts to self-quarantine this weekend, and by self-quarantine, I mean you do not leave your home. And if you absolutely must leave your home, you're going to wear a mask the whole time. And you're certainly not meeting with friends or going out to restaurants or on dates or anything like that. If everybody who's going to be involved can self-quarantine at home for 2 weeks, and then if, to be extra safe, everybody wanted to purchase a test and get tested, say 3 days prior to the gathering, then I think, yeah, it can be done safely. Now I say 3 days because it takes about 48 to 72 hours for these tests to come back. You can buy COVID tests now at most pharmacies, most larger pharmacies in town. I've seen them all over the place. And you basically swab yourself at home and then you drop them in overnight mail and they go to a lab and you get the results back online. They're pretty expensive. They're like $150 each. But if you really want to get together, or if grandpa really wants to get together, you could do it that way. And I think that would be about as safe as you could do it. If you cannot assure that everybody has self-quarantined, or if you cannot afford to test everybody, then I'm agreeing with your sister. I think doing something else this year makes more sense. And then as soon as we're through this, or as soon as grandpa has received his vaccination, then you all could celebrate a delayed Christmas. So those are the 3 questions for this week. Oh, and one other thing on that last one, turn on that app, turn it on now, because that'll help also make sure that nobody who may be there may have been in contact with other people. So thank you for your time. We're not going to be doing this again yes, we are going to do it next week. And then Christmas week, I think we're going to take the week off. So thank you all. See you next time.